Hi, I'm Dr. Brian McGee, physical therapist with Rexercise. So today I want to talk about ankle sprains. Super common injury, super recurrent injury, right? We've all sprained an ankle. Most of us have probably sprained an ankle multiple times. And so today that's what we'll talk about. We'll also talk a little bit about prevention, but in a future video, I'll talk more about some advanced exercises for those who've had an ankle sprain and really get more into the details of prevention. So that'll be in our upcoming video. Before I get started, I just want to mention, if you like my content, if it's helpful for you, please click those like and subscribe buttons. I'd really appreciate it. You doing okay, buddy? You're doing a great job. So, ankle sprains. We tend not to think much about it. We tend to blow it off. We tend to think it's a pretty minor injury, and mostly it's a minor injury. But what people don't tend to realize, or really don't realize at all, is it's actually pretty common for people to have some level of chronic symptom after an ankle sprain. So up to about 30% of people who have an ankle sprain have some lasting symptom a year later. They have some loss of range of motion, loss of strength, pain, and that's translating into some practical limitation, trouble in a sport, trouble in a physically demanding job. About 25% of people who have an ankle sprain have the same problems 3 years later. So it can be a pretty chronic and troublesome injury, and we'd almost definitely be better off getting a little more treatment on the front end rather than the back end. So today's program is for that patient who's just come into my office, for example. Just had a gentleman this week. Just come into my office, they've recently sprained their ankle within the last week or two, maybe 3. They're usually in a boot or in a brace. And so this is where we get started. This program is for them. Okay, our first exercise is actually for the hip. So we're strengthening side hip muscles. So side hip muscle weakness is actually a risk factor for sustaining ankle sprains, especially in our athletic patients, our soccer players in particular. So with your back against the wall, you're simply going to keep your heel against the wall while you move the leg up and down. We're strengthening a muscle called the gluteus medius muscle. And the point of using the wall is it serves as a vertical reference. It keeps us moving our leg in a way that keeps that particular muscle engaged and working. So simply lift the leg up and down, keeping the heel against the wall 10 to 15 times, a couple sets of 10 to 15 times. So our next exercise is for the outside ankle muscles. We call this ankle eversion is the name of the movement, okay? So with the band secured around something, so here I have it on my bench, you can just close it in a door, okay? Keeping the heel down, keeping the heel fixed. You okay? Okay, heel stays still. Point the toes out, come back to the middle. Point the toes out, come back to the middle. Back and forth 15 to 20 times. Again, keeping the heel still. Right, bud? Okay, now we're simply going to do the opposite movement. We call this inversion. So now we're strengthening muscles on the inside of the ankle. So again, keeping the heel fixed, keeping the heel still, point the toes in and out 15 to 20 times. Okay, the next exercise, again, is a stretch for ankle dorsiflexion, or a stretch for some of the calf muscles that can stiffen after an ankle sprain. So I'm sure many of you have done this very common stretch. So foot back, hurt side foot back, foot flat. Now one pro tip, keep the toes pointing forward rather than out here. Right here we'll tend to stretch kind of the midfoot rather than the calf and ankle. So foot forward. Also have a shoe on for this, some arch support. Again, without the arch support, some of the stretch will be directed into the midfoot rather than the ankle. So again, foot flat, simply lunge forward with a straight knee and hold this for about 20 to 30 seconds. Our last exercise is simply a balance exercise. So one of the things we lose after an ankle sprain to a surprising degree is our sense of balance. And part of that is when we damage ligaments anywhere in our body, but our ankle is just the most common example, we lose some of the, or we damage some of the nerve endings that give us our sense of position and balance. So we want to get that back. Also, balance-related exercises are preventative of future sprains. So our first step in this direction is simply trying to balance on the hurt side. Have something for support to start with, a chair, a countertop, and simply try to balance for about 20 to 30 seconds at a time, 2, 3, 4 times. Now, if you're really ambitious, what I frequently have patients do is try to balance while they brush their teeth. If you can balance the whole time that you brush your teeth, that's actually pretty tiring. It's more tiring than you might think. It sounds silly and simple, but it's actually difficult. But anyway, so balance is a big part of ankle sprain rehab, and we'll do a lot of that in our subsequent videos as well. That's our phase 1 ankle sprain rehab video. I hope you found this video helpful. I hope it helps you get back to what you love to do. Please like or subscribe. I'd really appreciate it. And in the next video, we'll talk more about prevention, and we'll get a little more aggressive in our strengthening and balance training to get that ankle back to where we need it to be. We'll see you then.